We know it's a big step when parents decide to consult a professional about the emotional, behavioral health of their child. And we try always to be sensitive to that fact. If you do have a question or wish to initiate a consultation with the Lucy Daniels Center, just give us a call and we'll help you from that point on. What we'll ask you to do is to fill out some information, we call it a request for consultation, and send it back to us. When we get that information, we'll review it within 24 hours and decide if indeed is the right match of your needs and the services, evaluative services that we offer. Most of the time it is, but just in the event it's not, we want you to know right away and we help steer you to the right resource if we can. We like to see families within 2 weeks of the time that a family contacts us and sends the information. We can't always do it. Sometimes our waiting lists are too long. We do our best, but you would know that if you're a parent and contact us, that we're certainly sensitive to your need to be seen as soon as possible. When we do meet with you, the very first thing that we do is meet with the child's mother and father and sit down and get a history and understand about the child's strengths and the child's challenges. And once we have been able to determine some information about the child, we will make a recommendation as to whether we can get to work right then with some ideas and solutions or whether it's necessary to do more of an evaluation. Most of the time it is important to do more of an evaluation. And this is because we believe very much in Lucy Daniels that sometimes the quick answer is not the right answer. That we want to take the time to be sure that if we're offering help to a child, that it's the right help and we've reached the right understanding. So very often we'll suggest to parents that we take the time, that we meet again, that we get some more information, that we might want to meet with these teachers or observe the child in school, particularly if they're under 6. We may want to talk with the pediatrician. We certainly will want to meet with the child, and we will counsel parents about how to make this a comfortable experience for the child so that they feel safe and supported and that it's a positive experience. We'll generally want to meet with the child 2 to 4 times. Sometimes, if there's a specific question, we'll bring in our psychologist and we'll do some specialized testing. We're going to gather the information that we need to gather so that we can sit down with parents at the end of this process and feel confident that we've come to an understanding of their child's strengths, of their child's needs, and that we have a treatment plan that offers the best solutions for that child's particular challenges. We sit down in a final meeting, take as long as necessary to work through our findings and our recommendations, and at that point we work out with families what the best next steps are. In the vast majority of situations, we have the appropriate kind of treatment here at Lucy Daniels Center that a family needs. In the rare situation when there is a particular very specialized kind of treatment is only offered by a particular specialized place that works in this particular way, and we help a family get situated with what they need to move their child to the next step.